Oh, there she is. Hi, Monica.
Perfect timing. We are now live.
Welcome to this two-part series, Let's Talk about the COVID vaccine Part 2. This conversation is available in Spanish on Buncombe County Health and Human Services Facebook page. I am Carolina Siliceo Perez, Assistant Public Information Officer and Community Outreach Coordinator for the Buncombe County Sheriff's Office. As we navigate this critical conversation together, whether at home, work, or assisting our loved ones, we thank you for joining us this evening. We are thankful for Sonsontles Language Justice Services and our ASL interpreters as we strive to create safe, equitable, and accessible spaces for our community. We are also thankful to the YWCA for helping convene this conversation. Dr. Lavender will be introducing our panelists for the evening and will be facilitating this conversation.
Thank you, Carolina. Good evening. I am Dr. Annelise Lavender, Chief Program Officer at the YWCA of Asheville. We're so excited to be here tonight. Thank you to Buncombe County for this partnership and collaboration on this two-part event. At the YWCA, our mission is to eliminate racism and empower women. With partners like Buncombe County, we are intentionally holding space for this pertinent conversation, respecting the lived and the historical experiences of communities of color seeking medical care in the United States. In part one of this two-part event, we connected with trusted community voices and explored the history of mistrust in the medical system by communities of color and how that's influencing individuals' perception of COVID-19. The panel offered insight and possible action steps that are vital to creating a culture of trust between the medical system and people of color. Tonight, in our second town hall, we have a panel of experts who are integral parts of the vaccine journey, right here in Buncombe County, from pharmacists to community healthcare workers. And we will all be discussing several aspects of vaccinations and what that process looks like. Before we get started, please know that we won't be able to touch on everything today, but we're looking forward to getting the conversation started. As Carolina mentioned, after tonight's discussion, the Buncombe County team will be publishing a Q&A, and it will be live on buncombecounty.org with answers to the questions we receive in tonight's town hall. So please feel free to use the chat in this Zoom link. I, like many of you viewing tonight, have sincere questions about the COVID-19 vaccine, and I'm working to educate myself by connecting with the appropriate sources of information so that I can make an informed decision about my health for me and my family. That's why I'm so excited about tonight's panel, and I'm grateful for these experts who are here tonight offering me the opportunity to learn more. With all of that being said, I'd like to welcome our panelists and thank y'all for joining us. And we'll begin by going around our virtual room here and introducing ourselves and what our specific role is in the vaccine journey. Why don't we start with Annelise?
Hi, good evening, everyone. My name is Annelise Duncan. I am a fourth-year medical student, so I am participating in this panel not as an expert medical care provider, but more as an expert healthcare advocate, if you will. And I'm just really excited to be here. I'm having lots of these conversations with my friends and family, and I am very honored to be more accessible to this community. So thank you.
Hi, my name is Amparo Oviedo Acosta. I am a public health nurse at the Buncombe County Health and Human Services Department. And I've been with Buncombe County for 19 years. So it's nice to have this opportunity to talk to all of you. Thank you.
Hi, everybody. I'm Monica Dillingham, and I'm the pharmacist with Buncombe County, and I've been there for about 1.5 years. And so my role with the COVID vaccine is dealing with the inventory, receiving, and helping to get the vaccine distributed and administered out in the community. And I'm happy to be here. Thanks for having me.
I'm happy to be enjoyed by all of y'all as health advocates, community health workers, and a pharmacist. As I mentioned in part one of our series, we talked about the historical relationship that people of color have with the medical community, specifically around implicit bias. Can you all say in your specific roles how you've identified and counteracted bias, both personally and with your colleagues? I'll start with Amparo.
Yes, I basically have dealt with this and thinking about this question. I first of all try to have a personal awareness, of what it is that I have, or that I think, or that I recognize as my own biases in general, because then I can work on the behaviors that I need to change. The second thing that I basically have experienced is that I acknowledge the problem. I name the problem. We have a problem in this country. If we don't acknowledge that we have a problem in like healthcare related inequity, disparities, then we cannot act or face the problem. For example, I checked yesterday at the North Carolina Health Department of Human Services website, vaccines, which is a big topic right now, are showing the disparities that we have in this country. 79, close to 80% of the vaccines have been administered to white people. 13.77 to Black or African American people, 2.47 to Asians or Pacific Islanders, 2.34% to Hispanics, 0.73% to American Indian, and then the other 1.55% to, undisclosed races. So we do have a problem, with disparities, with biases, with prejudice, with you name it. We have to advocate, and what I have done is, we advocate for equity. We need to keep saying it. We need to keep voicing our concerns. And this is what I have done personally and with my colleagues where I work. And then, I try to say we educate ourselves about the problem, but not use education, but actually action. A famous quote from Thomas Jefferson is, "Knowledge is power." What I will add, knowledge without action does not help. So, those are that's what I think when I think about what am I doing personally and where I work about this problem.
Amparo, that's great. Annelise, Amparo did a great job of giving us sort of the stats of where we're at in the COVID-19 vaccine and some of the ways that we're really seeing this play out, not just in our county, but our country. What are some ways that you've seen it in your role as a health advocate and ways that you combat it in your personal practice?
Yeah, thanks for asking. I think as a medical student over the last 4 years, I've been poised in a really privileged position to really act as an intermediary between the experience of patients and my community and what it means to be a doctor. And in a lot of ways, I've been observing as much as I've been learning. And I think keeping my eyes open, being constantly aware of those implicit biases, that maybe I'm putting forth myself in the questions or the ways that I'm interacting with the healthcare system or even patients, and trying to really bring up what I see with the people who are teaching me, and not being, like Amparo was saying, not shying away from putting a voice to that, naming it and saying, hey, I see this and I'm, let's talk about it and let's have a conversation so that we're not in this same position again. In my role, especially during this past year, I've spent a lot of time doing the research, getting that knowledge so that when I am practicing and when my feet are really on the ground, working with patients day to day, that I'm ready to be aware of and address those inequities that I see. That, you know, at this point in my career, I can't separate healthcare inequity from any other inequity. There is no difference. You know, if you can't access healthy food, I can't ask you to have a healthier diet. You know, there is no difference there. So I've been doing a lot of reading, listening to an incredible amount of podcasts by Black and Indigenous and any creator of any minority experience that I can get my hands and ears on, and really trying to invest in this area too, and understanding Appalachia especially a lot better. I grew up in North Carolina, but I'm relatively new to this region, and I want to be sure that I have a little more awareness and connection to what is actually happening to the people in this place.
I love the connection between observing, naming, and doing, and all being a part of a connection, which brings me to Monica. Pharmacists have a direct connection to all of us when we're going to pick up our medicines. Can you share a little bit about your role and how you navigate bias?
Yeah, so I think, what stands out to me is, first of all, I can't make assumptions. I can't assume that somebody doesn't want to get the vaccine. At the same time, I can't make an assumption that they don't want to get the vaccine. I need to just have open ears and listen to what they tell me. And I think a lot of times as healthcare providers, we do a lot of talking and we don't do enough listening. Sometimes we can dominate the conversations really easily, especially if we've educated ourselves so much about this vaccine. We know a lot about it and how it works, but we still have to make sure that we're listening to people as much as we are talking, and being aware of their needs and their preferences, rather than assuming that it's one way or another. So I think that's one thing that I personally am working on, is just having open ears and listening as much as I am talking.
Speaking of listening, this is really a really organic conversation that I hope to have with all of y'all about my own personal interest in getting this as a member of society experiencing a pandemic. So I'm ready to listen and learn from y'all. Annelise, I'm going to start with you. If you can just explain to me the science of a vaccine. So like lifting us out of COVID-19 just for a second, like what is a vaccine? How does it work? An immunization? What's the difference? How do you take them? All of that. Just all of science right now.
All of the science. Excellent. This is what I've been training for. This is 4 years in the making. And I'm very excited to have this question because I think that viruses are actually really fascinating, and as such, vaccines are just as fascinating. So like, what is an immunization? Very plainly, it's a tool for our body to help our immune system boost its defense against germs without a person ever necessarily having to get that illness. I mean, that's the goal, that you don't get sick with it. And so when you get an immunization or a vaccine, you're hopefully preventing the disease or preventing you from getting sick, or lessening the how sick you get if you do happen to get sick. So basically, you're stimulating the immune system, and how that happens is pretty cool. So viruses, I like to think of them as just like a little machine, a machine that makes more viruses. That's all it does, and that is all that it is packaged to do. And it can't actually do that without the factory. It's just kind of, like a machine sitting on the sidewalk. So its whole goal is to get to the factory, and our factory, or our cells, are that factory. The machine gets in the factory, it uses up all of the equipment, all of the tools that the factory has, makes more machines, and moves on. And basically, we want to be able to find our bodies, have this great system set up where if foreign machines come in, or like a machine that shouldn't be in the factory is in the body, its whole goal is to get in and dismantle it so that it can't so that the virus doesn't exist anymore and can't do its job. And the body is really, really good at it on its own. Usually that's what it's designed to do. It wants to keep you healthy and safe. But the body can't do that, or your immune system can't do it very quickly if it's never seen the virus before. It's kind of like, you know, we're talking, Dr. Lavender, and I'm like, meet me at Joe's house. And and then I walk away and I leave, and you are the body cell, and you're like, well, how do I don't know Joe. I have no idea where Joe lives. How do I get there? And I bet, you know, you're smart. You have lots of tools at your discretion. One way or another, you could maybe find your way to Joe's house, but it would take you a very long time because I haven't given you any of the necessary information. Well, the vaccine is like giving you the address so that you can get there quickly. You can get to Joe's, you can reach your goal. So in vaccines, you get like a little piece of information about the virus that your body is trying to find and get rid of, and like the address to Joe's house. And so the vaccine goes in. It's usually, you know, like a piece of mRNA, which is the new thing, or a piece of like the outside of a virus, many pieces. And so your body gets introduced to that, it recognizes it, and the next time it sees it, it knows, hey, this shouldn't be here. I know exactly what I'm looking for. And every time it finds it, it can get rid of it. And now I feel like I've really danced around the question. I can't remember what other pieces I needed to answer. Go ahead, Dr. Lavender.
Oh, no, I just want to encourage you. That was amazing.
Oh,
As a person who relies on Google Maps to live, it's an address. We got it.
Yeah.
So are they safe? Are vaccines safe? You said that it gives the outside of the cell. Does that mean that it's giving me the virus, or what does that mean?
Yeah, that's a really great question. Vaccines have been around for a long time, and they've gone through many different designs. At this point, the vaccines that we're using are rarely ever the live virus. So you're just getting like a little piece of it. Maybe there are proteins on the outside of a virus. It kind of usually lives in a little capsule, like a spaceship, or like it's the metal encasing on that machine that I was talking about. So you're just getting those pieces. That's something really distinctive about the virus, so that you don't have to introduce the virus itself. But if the virus, you as a person do come in contact with the virus, your body recognizes that really specific piece, that flake of metal, or that spike protein, whatever it is, and it says, hey, I've seen this before. Let's go get that and get rid of it. So you're not getting, and the vaccine doesn't have the virus. It just has very specific parts, or replicas of parts of the virus in it. So it's very safe. And then some people also wonder, like, if there isn't any virus in it, why do I get side effects, or why do I feel bad after getting a vaccine? And that is usually just because your immune system is working. The body is doing what it should. It's seen something different that shouldn't be there, which is exactly what we put into the vaccine, the thing that shouldn't be in your body. And your immune system is waking up and it's saying, hey, let's get rid of that. And so things like fevers is a pretty natural immune response. It's almost like cooking the bad thing out of you, because proteins like to live at a very certain temperature. And so your body raises the temperature so that, those things break apart and kind of, they don't really dissolve, but that's kind of the idea. Or, getting a headache or a sore muscle, or, kind of those aches like the flu, that's all the immune system itself, not the actual virus.
Wonderful information and imagery. With all of that sort of background and understanding about what a vaccine is, Monica, can you walk me through the COVID-19 vaccine specifically, some of the ingredients? I understand that there's different types of the vaccines, like different companies made the vaccines. If you can just sort of walk us through COVID-19.
Yeah, sure. So So the COVID-19 vaccines that are available now are mRNA vaccine, and mRNA stands for messenger RNA. And so basically what these vaccines do, mRNA is a strand of instructions that tell our muscle cells basically how to make the little spike protein that is on the surface of the coronavirus. And so, like Annelise said, that's very distinctive to the virus. It helps your body recognize it very quickly. So basically what happens is the muscle cells are given instructions through the messenger RNA to make that little spike protein. They present it onto the surface of the muscle cells, and then your immune system starts to recognize it as foreign and starts to make antibodies and other defenses against it. So there's no, like we said, there's no virus in this. It's just basically a set of instructions that tells our bodies what to do. I think one thing that's so neat and fascinating about the development of the vaccine. So even though it seems new and it is a new technology for vaccines, it's been studied for many years. Even since, for a couple of decades, they've been looking at this as a potential way for vaccine development. They've even studied it for other diseases like Zika. And in cancer research, and even for rabies vaccinations, they've studied it. But we've never been in a global pandemic like this where we've been to the point where we needed to have something so quickly to respond to this emergency. But we have had these in development for quite some time. In terms of the ingredients, they're actually pretty simple. There's the mRNA strands, and then they have to put a couple other ingredients in there to keep it stable. mRNA by itself is very delicate. It breaks up and breaks apart easily. So they have to make sure that they have the correct pH balance in there. So there's some salts, there's some acid stabilizers or pH stabilizers. And then there's also some sugars, specifically sucrose, which helps stabilize the mRNA molecules, especially like for transport. So it's very simple. There's no preservatives in these vaccines. There's no latex. There's no, and of course, there's no part of the virus itself. So just really basic ingredients. And so people that have had concerns traditionally about some of the additives in vaccines, these, don't have any of that included in their list of ingredients to be cause for concern.
Great. And just a quick follow-up question for that. Viruses, as I understand, are always evolving, and we're seeing new COVID variants discovered, throughout the world. How does this vaccine relate to that? Will it be sort of like a flu shot where you have to get it every year, or is it too soon to tell?
Yeah, so there are some other variants that have been discovered. Specifically, there's a UK variant, and then there's also a South Africa variant, and I believe a Brazil variant. Moderna and Pfizer have both studied their vaccine against some of these variants, and what they know specifically for the UK variant, it's equally effective. So you're still able to mount that good antibody response for the UK variant. They have seen a slight decrease in the antibody response with the South Africa variant, but they still see good antibody production. So the thought is that it's still effective for that variant. What they're studying right now, both Moderna and Pfizer, are possibly a booster dose or a third dose that would work better against variants as they are discovered. But right now we think that there is some effectiveness, good effectiveness against the variants that have been identified. And then in terms of getting it every year, we're not real sure how long immunity is going to last from these vaccines because they're new and they're still in clinical studies. But a lot of experts agree that your first and second COVID vaccine may not be your last, that it may be something that you get yearly or periodically to keep your immunity up.
Speaking of immunity, Monica and perhaps Annelise, you can jump into what is herd immunity exactly and why do we want it?
You want to take that one, Annelise, or I can talk about that. So herd immunity is basically where, so there's two ways to get herd immunity, right? Like either everybody catches the virus and we build our natural immunity, or we distribute a vaccine that gives us immunity. But it just means that a certain percentage of the population has immunity so that the virus doesn't spread and isn't transmitted as readily.
Annelise, is there anything you'd like to add?
No, I think that was great. Yeah, it's just having, like Monica was saying, the majority of the group has been exposed or been vaccinated, and it kind of creates a buffer around, you know, the one or two, or, you know, the few individuals who haven't, and makes infection and transmission less likely.
Thank you.
Can I mention one thing about that? The goal, we can all think that, we get the disease and we get the herd immunity, and that's one way, certainly. But, we see that a lot of people unfortunately have died, from the disease. Another way to get that immunity that we want, so that the virus doesn't mutate the way it's mutating, because the more people that get infected, the greater the chances that the virus will mutate, and we get all these variants. So another very effective way is prevention, which is what the vaccine is doing. The more people that get the vaccine, the less chances the virus has to keep infecting other people and keep mutating and to have all these variants. So I think I heard last time Dr. Fauci said 70% to 85% will need to get the vaccine in the United States to have that, immunity or prevention, so that the virus can be controlled and not be like creating more and more mutations.
I love the way you explain that. So herd immunity isn't something that we should be relying on by everyone just getting sick, but something like a goal that we can reach by prevention. Else we run the risk of mutating, the virus getting too strong and mutating itself, and then people just unnecessarily dying and getting sick. Am I keeping up with y'all? Good, okay. Monica, this one's back to you. What type of certification process do vaccines go through? So you sort of mentioned that the vaccine was created, it seems as if it was created quickly, but we had the historical science behind it. But how is it certified? How did it end up in our world?
Yeah, so first of all, there's sort of this preclinical research and development where scientists are looking at, what's effective, like we mentioned earlier, what is that piece, that identifiable piece of the virus that our body's immune system can recognize very quickly and start to make our body's defenses really quickly. So that kind of all happens in a preclinical phase. And then we enter into what's called a clinical trial, and there's several phases of that. The phase one in a clinical trial is generally where they take small numbers of healthy volunteers and they give them the vaccine just to test out what the right dose is going to be with the minimal amount of side effects. So they're basically trying to come up with what's the right dose. What are we going to inject as a dose for this particular vaccine? They also are looking at side effects into phase two. They're looking at larger populations, looking at side effects. Then in phase three, they sort of roll it out to a larger number of people where the question there is, well, is it effective? Does it work? Does it keep people from getting sick? Does it build antibodies against the virus? After after they're completed the phase 3 trials, they can make an application to the FDA for approval. And this is a process that all medicines and vaccines have to go through to be approved. It's just in the case of a public health emergency, there's something called a fast track. It's like, we have enough medications for high blood pressure right now. So if you've got an application for a new blood pressure medication, you might get pitched to the back burner while the FDA focuses on what's front and center, which is our COVID pandemic. And so they kind of get special priority with the FDA in terms of looking at these applications, going through all the evidence and making sure that it's, safe and effective. And then so that's the point where we are. The phase 3 trial information has been presented. The FDA has approved the 2 vaccines, mRNA vaccines, for emergency use authorization, which means we can use it in terms of this, public health emergency that we're having. And then they'll go into phase 4 trials, which is kind of longitudinal or longer trials, where they answer those questions like, well, how long does the immunity last? They look at effectiveness over longer periods of time. So that's kind of like post-approval kind of phase 4 trials, where they're looking at gathering more information in larger groups of people.
And what is the FDA specifically looking for? Like, would this vaccine, we were in a pandemic, it's high stakes, would they have bounced it back to the pharmacies or the pharmaceutical companies?
Yeah, so what they were looking for was, number one, they were looking for effectiveness. Does this prevent people from getting sick? The other thing is they were looking for major side effects. And, generally what they saw in the clinical trials was similar to what they're seeing in the general population with side effects in terms of that immune response, the mild symptoms of, fatigue, maybe achy, maybe, feeling tired, or low grade fever, things like that, which is certainly your immune system kicking in gear. But they were looking for things that were outliers that maybe weren't related, to the immune response. They look for allergic reactions and things like that. So generally, another thing I want to say about the clinical trials, and what I think is impressive about these that Moderna and Pfizer did, I think some of the clinical trials in the olden days, they were all done in middle-aged white men. You didn't have a good demographic of people that gave you a good representation of what our US population looks like. So the good thing about these clinical trials is they had a good representation of people of color, women, all the age ranges from, the Pfizer trial was age 16, all the way up to age 85, so you had a good representation of all the groups there, with the vaccine looking effective again across all the groups, which was good news.
Thank you, Monica. That's all very helpful to understand about how it was created. So now that we have an understanding of what a vaccine is, what the COVID-19 vaccine is specifically, Amparo, I want to ask you, if I am deciding to get the vaccine, can you explain the process of how one signs up for it? Perhaps maybe we can start with just the phases. Can you explain these phases that are existing?
Yes. So we have guidance from the CDC that the states are following. And I want to say that each state is following, is basically making their own guidance from the CDC guidance. In North Carolina, we have 5 groups, basically, that the state is calling the distribution groups. So in group 1, we basically have the healthcare workers and long-term care staff and residents. Group 2, we have the older adults, those people that are 65 and older. And those 2 groups are the ones that basically we are vaccinating right now. Group 3 is going to be the frontline essential workers, this group has a lot of people that could qualify, for the vaccine, like people that work in transportation, education, in, food processing plants, in migrant workers, those essential workers that actually have to work in person and have been working in person mostly for the whole pandemic. So that's group 3. And then group 4 is basically those adults that are have a high risk of exposure and increased risk of severe illness. So a lot of more people. And then the 5th group is everybody else that did not fit into those other 4 groups. These groups and these guidelines, and like with anything with COVID, it has changed a lot. I mean, Monica, you can attest that sometimes we don't even know, way ahead of time when the changes are coming. Today we heard from the governor that we're gonna open on February the 24th. We're gonna open one of the groups in group 3. So group 3 has a lot of people. We're gonna open one of the groups basically for educators. And this will be teachers from kindergarten, pre-kindergarten through 12, and also for childcare staff, in North Carolina. So that will happen on the 24th of this month. And then the governor said that on March the 10th, the state will open other groups in group 3. So basically, right now we are in groups 1 and 2. February the 24th, one group of the group 3 will be open, which will be the educators, teachers, childcare workers. And then on March 10, other groups in group 3 will open. So, in a very few words, those are the groups.
Thank you. It's promising to hear that they're going to move, that the vaccine groups are opening up, especially for teachers and childcare workers, as schools are planning to be back in session in person. A quick question I have about that is that I remember hearing that there was not enough vaccine to go around. So even though these groups are open and people are able to, it's their spot to get their shot, is there a shot for them?
That is true. Unfortunately, we have limited supply of vaccine in the whole country. I will venture to say in the whole world, because it is a pandemic. The hope is that, we'll get more vaccine and that other pharmaceutical companies will get approved to basically, after they go through all that, all that process that Monica explained, for more vaccines. So yeah, the way it works is like the federal government sends vaccines to the states, and then the states send vaccines to the counties, and then the counties follow the rules, from the CDC, but each state has also their own way they're doing the distribution of the vaccines.
Perfect.
Was that clear?
Yes, I'm learning so much. So if I want to find up-to-date and clear information about how I can get a vaccine, then where should I be looking? Should I be looking at what level? The county, Buncombe County, or?
I will say, that there's a lot of information out there, a lot. I mean, if you want to Google, COVID-19 vaccines for North Carolina, you probably find a lot of information. So information is not a problem. The CDC has information about the vaccines, and then it takes you to a link for the state website. And then the state website, sometimes takes you to a link to the local level. So I will say, the state is doing a great job of basically putting information out there. people that want information about vaccines can go to yourshot.nc.gov and find, information about which group they belong to, or where can they go get a vaccine. Are they eligible to get the vaccine right now? Basically, I also know that this state has vacunate.nc.gov, which is in Spanish. All of the information at that particular site is in Spanish. And then also at the top side of the website, at the state side, you can actually change the language to other languages. So information is not a problem. From there, like I said, you can get a link to local facilities that are doing vaccinations. At Buncombe County, we have created the buncombeready.org website. So that website has a lot of information as well about, the wait list and about where we are, how many vaccines have we given, how many vaccines we got from the state, how many, where are we on the waiting list. So I will say locally, buncombeready.org is a great resource. People can also, sign up for BC alerts. And if you dial, if you text BC alert, just like that, BC alert together, one word, to 888-777, you sign up for alerts for Buncombe County. And as soon as Buncombe County opens another group, to call to get on the wait list, people get notifications via text about, okay, where can I open, the wait list for group 3 for teachers. And then people can go online at Buncombe County, at buncombeready.org and do a little survey, and that way it goes into the waiting list, or people can call the Ready team. And I can give the number also is 828-419-0095. And then they can get into the wait list that way. So many different ways. Information is not the problem. I just think that people sometimes don't know where to go, but I will say, Google it. If you are in doubt, call your health department, and there's a lot of information out there how to, get on the wait list.
That's great. So that's buncombeready.org.
Yes.
And then there's also a phone number. And then if all else fails, Google will direct me to some of these different sites for additional information. So, there's all this information out there, Amparo, like you said, and some of it has people worried about if the vaccine is safe, and there's some misconceptions about what this vaccine is and if they should take it. I'm hoping to open up the conversation for you three to sort of discuss some of the misconceptions that are existing, and maybe we can assuage or speak to some of those fears.
Yes, there's a lot of myths and rumors out there, and it's human. This is a new thing. People get nervous. I mean, some people think it just like they made it so quickly that maybe they did not make it right. Well, mRNA vaccines have been studied for years. I mean, more than 50 years. It's just that, this is the first one we have, but it's not to say that they have not been studied before. Some of the rumors that I have heard is that it will alter your DNA, or that it has a microchip, that the government is trying to, follow us or something. Of course, from what Monica and Annelise have explained, the way they made the vaccine, basically the vaccine only has, very few ingredients, the mRNA, the salts, the sugars. It doesn't have any microchips. and it will never get to the DNA. It doesn't go into the nucleus of the cells. Another thing that I have heard is that the Moderna and the Pfizer vaccine were actually produced using fetal tissue. And this is a big deal for some of our Christian religious, communities. And the research that I that I have come across to, and basically, the Pope got the vaccine, right? So he said, I mean, that's a rumor. It's not true. For Moderna and for Pfizer, there were no fetal tissues used to produce the vaccine. Again, it just has those ingredients that we keep mentioning. And then another thing is, I'm not going to get the vaccine because I might be pregnant, or I'm pregnant, or I'm breastfeeding. In Buncombe County, we are, if we are in your group and you're pregnant and you want the vaccine, you can get it in Buncombe County. Those are the things that I have heard.
And I'll just kind of piggyback on what Amparo said about the little robots. And I think as I was doing some research yesterday and kind of looking on social media and where some of these things come from, one part that I left out in the vaccine ingredient, also part of the stabilizer, what kind of surrounds and wraps that mRNA molecule or strands, is something called a lipid nanoparticle. And nanoparticle, or that sounds really like sci-fi or scientific, and it almost reminded me of nanobots, and so I think that's where that misconception comes around that. Basically all it is it's little tiny particles of lipids or fats that surround that mRNA strand to protect it, because otherwise the mRNA, like I said, is too delicate to get to where it needs to go to give those instructions. So I think that's where that misconception comes with the little robots or microchips and things like that. Another thing that I've heard people say is, oh, well, I can stop wearing my mask now. I've had both my doses of vaccine. And so, we want to make sure that we continue the 3 W's: wear your mask, wash your hands, wait 6 feet from others, until we get all our loved ones and our community members and people that we love and go to school with and work with, until everybody's been vaccinated, before we can stop those social distancing and those precautions in terms of wearing our mask and washing our hands. So that's one thing that I try to make sure that I'm telling people as I'm giving them the vaccine. Remember to practice the 3 W's until the CDC until we're told that we can stop. So.
And the only thing that I would add is a conversation that I've heard a lot in my circles, which is, I think I've already had COVID, and so I don't need to get the vaccine. I'm already immune. And I was also doing my research, making sure that I'm telling you the most up-to-date information as well. And the experts are really indicating that it is still appropriate to get the vaccine, even if you have been sick or think that you did have COVID, sometime during the last year. And Monica was talking about, if we're getting this vaccine and it gives us some sort of immunity, and that's kind of like being exposed to the virus too, are we getting the vaccine again? And, there is a chance that could happen. They may be developing some sort of booster. And if in your mind it helps to think of it in a different way, you might even want to consider getting the vaccine as almost like your booster shot. You're doing the most good for yourself and also for your community, and making sure that you are contributing to that herd immunity, but also you're keeping yourself safe.
Those are all definitely things that I've heard before, especially I think I've had it before, or I think I would be okay if I got it. I noticed that a lot of people are sort of weighing their options of getting COVID, what they think their outcomes would be, and getting the vaccine and maybe what their fears are of that. Do you all have any sort of commentary or advice about someone who's in that boat?
Well, I will just say that from the cases that we have seen in Buncombe County, like we have seen people, young people, older people, get very sick. And unfortunately, like I said, some people died. And because it's a new, virus that we don't know everything about, we don't know the long effects, that this will have in our bodies, if it will have any. So, I will say prevention is the key. That's our goal in public health, and I know it's scary, it's new, and we hear all kinds of things, but we don't know if whoever is waiting to get immunity is gonna make it or not. I mean, to say it in a very few words, or how sick they will get, or how it will affect, in the long term, their bodies.
Thanks for that. So now that we have some even more background, I get the shot. What is my pre and after care? So I should still be wearing my mask, but is there anything else that I can expect? Annelise, do you want to take this one on?
Sure, yeah. So pre getting your vaccine, you still want to be taking care of yourself, wearing your mask, washing your hands, keeping 6 feet distance, trying to reduce your risk of getting sick with the virus beforehand. So, monitoring your symptoms. You don't necessarily want to go in there into an enclosed space with a lot of people who are also hoping to get vaccinated and, accidentally expose people to the virus. So that's really the only pre-vaccination routine that I would consider. And then the post-vaccination, we talked a little bit about some of the side effects that you might expect. Really common ones are feeling feverish or a little flu-like. So having kind of those muscle aches, especially in the back, or a headache. Those are common symptoms, and those are signs that your immune system is doing what it's supposed to do. And you might also, like I have a very sore muscle. My arm was really sore, and you can treat those symptoms. I used an ice pack and I felt much better. You can take an anti-inflammatory to help with some of those other symptoms. And if you have the ability and flexibility, especially after the second dose, you might want to consider having a more relaxed day afterwards, but that's not entirely necessary. But being aware that you might have some side effects, feeling a little under the weather for a few hours is something to consider. And then still wearing your mask and washing your hands and keeping socially distant.
And I'll just say a couple of things about making your experience at the vaccine clinic a little bit more comfortable. We have to get all the way up here at the top of your arm. So maybe it's cold out now, so cold, and we're dressing, in warm, lots of layers, but just make sure that your sleeve is loose enough to pull it all the way up so that the nurse or pharmacist or doctor who's administering the shot can get all the way up in the top part of your arm. And then, like Annelise said, maybe don't do it the day before you're going to run that marathon or start your spring garden or, clean out your garage. Like, make sure that you've scheduled some time for yourself to eat healthy and drink plenty of fluids and, get some rest the next day, just in case you are one of those that experiences some of the side effects afterwards.
That's a great pro tip about wearing something that is easily rolled up.
Mm-hmm.
So even still, there are a lot of people who it's not their turn yet. and they want to wait and see what happens to other folks in the community. What is your advice or something that you would tell folks who are in the wait and see category to help them get off the fence? What should they be waiting for? What should they be trying to see? How can they be prepared when it is their turn? Amparo.
Oh, I go first. Okay. I will say it's your choice. You can decide if you want to get it or not. I will say, we need to think about all the devastating effects that the pandemic has had in our world, in our communities, in our personal life. Everything has changed. Prevention is the key to slow and stop the pandemic. We know that vaccines work. We know that we had been able in the United States to actually not have some diseases because of the vaccines that we have used for a long time, like polio or diphtheria or other preventable vaccines. So we know vaccines work. And also, it's okay, it's normal to be thinking about it. I mean, it's okay to ask questions. I would just say, go to the facts and not to the myths. Go to reliable sources and not sources that are just scare or trying to make people scare. And then the last thing I will say is, I think it's our duty to protect ourselves and other people. Some people cannot get the vaccine. Some people, we know that children is not approved for children. The ones that we have right now, 16 years and older. And even though, we know that we can get that herd immunity by getting the disease, we know how devastating and how many people have died from this disease and all the, the suffering and that the families have had because of this disease. I will also say, continue doing the 3 Ws. Even if you decide to do it, if you decide not to get the vaccine, do the 3 Ws. Either way, wear your mask, maintain the 6 feet of distance from people that you don't live with, and wash your hands with soap and water.
One thing that I want to mention when you're thinking, and so everybody has to make that decision for themselves, whether or not they want to receive the vaccine. And I know people are putting a lot of thought into this. They want to know how it's going to affect them and their families. And, there's a lot of thought that goes into this, and it's not to be taken lightly. And we certainly understand that. I think it's important to know what you're going to compare getting the vaccine or not getting the vaccine too. So, you can't, I would suggest not to compare it to just doing nothing, because doing nothing may mean that you would contract COVID and possibly put other people at risk because it's so widespread in our community right now. So compare getting the vaccine, I think, with what your risk would be if you were infected with COVID, and then what your risk to others, like family members or loved ones, in terms of that transmission, and kind of use those things to make your decision based on your risk. Realizing that the vaccine, it's there's, 9 out of 10 people get a sore arm. 50% of people may feel tired or achy the next day, but then the alternative, in terms of possibly being exposed or transmitting COVID infection, also has truly detrimental effects too. So weighing those two out and make your decision based on that.
I guess if I can be frank for a moment, I would also think about for I would think about, the people who may still be on the fence. If those are, people in the minority community, Black, Indigenous, Hispanic, Latinx, any people of color, the impact that COVID has had, like Amparo was talking about, and like we were talking about in the last Let's Talk series, has really, it has come for the Black community, for the Latinx community. There has been, I think devastation is an appropriate word. And all of the times that we as a community talk about the different disparities that there are, health disparities, socioeconomic, everything that this country has kind of designed itself to perpetuate, this virus and the way that it has impacted us has only enhanced that. So if you're on the fence, think about your herd. We were talking about herd immunity. It's like, who are you protecting and who is protecting you? And in getting this virus, in getting the vaccine, who can you protect? And in your family members and your other herd members getting the vaccine, how are they protecting you? I think that's a really important question. And if you are a person in a rural community with less access to healthcare, different resources, if you are, quite frankly, a Black or Latinx or Indigenous person, I think it matters even more. Your herd is more at risk. Your herd is more exposed to the elements, and I would just encourage you to think about, what Monica was talking about. How will it impact not just you, but also the people that you're around if you do get the virus and you are not vaccinated, versus if you get the virus or get exposed to it, but you are vaccinated. And I think that there is no reason to thin any of those herds anymore because of this virus than what is already happening without it.
Wow, thank you all so much for engaging in this conversation with me. I love that we've situated it in a personal choice that affects others, whether it's our herd and protecting us from getting sick, or thinking about who we can transmit to based upon our circles. And I agree, Annelise, I don't think our herds have to thin any more than they already have. With that, I want to thank you all, Annelise, Amparo, Monica, for joining me today and really engaging in these questions thoughtfully, and to our ASL and Sinzotle interpreters who have made sure that there's access to our conversation. I'm so grateful and honored to have been here.
Thank you.
So Dr. Lavenders, thank you to all our panelists and all naming of our ASL interpreters, and those are Smith and also Crystal Bradley. So thank you in advance our language justice.
So there's something going on with your voice. I don't know what it is, but it sounds like, I don't know.
Check.
Oh, that's better. That's better.
So this may just become a viral video, and that would be a good thing. But we do want the viral component of this to be the clarity of facts and the clarity of this connected message about health equity, accessibility, and that clear, relatable information on what's available around the COVID-19 vaccine for Buncombe County community. So we thank you again. And as the panelists said, while it's your community, it's your family's decision to make that move and get connected to a vaccine appointment when the appropriate phase opens up for where you are. But in addition to that, to continue the 3 Ws, as that's one of the best and evidence-based, surefire ways that we can control the spread of this vaccine and not see any more kind of unfortunate circumstances for our community. So I have a final ask for you. We've shared with you through 2 conversations with community partners that are really committed to social justice, the history that's informing what is making many of our community ready, and others in a wait and see place. Won't you please consider accessing all of the resources that we've talked about to hold a conversation with your loved ones, one of your community groups or your faith group, or maybe your neighborhood association, to make sure that they have the facts. We know that the COVID-19 vaccine has lots of confusing information. One of the things that we have available through the Buncombe County website, through these recordings, and also through the North Carolina DHHS website is the facts. So please consider going there. There's lots of information in English and many of the other languages that we hear and we are connected to here in North Carolina. So until next time, wash, wear, and wait. And remember, if you want to continue getting the best information, please continue to come to buncombecounty.org. Be well and stay safe, and share this message.